As a care coordinator, you're an integral part of someone's circle of care, meaning the people in the community, like their physician, their nurses that they might see, and their family members and other community service. You're an integral part in connecting all those pieces together so that they can provide a wrapped service for the individual that you're working with. So our role is really to pull everyone together, pull everyone onto the same page so that we can go forward together.
Calling with regards to just a bit of an update. The patient actually, I had called her today, and
the most important thing is what the client thinks is the most important thing. So if their goal is to stay at home and stay with their family, then that's what we're going to do. We're going to support people to stay at home. We start with, what is it you want? What is it you need? And then we work with them to develop a plan to achieve that.
He was diagnosed with mitochondrial myopathy, and that's basically muscle disease, and it robs him of all of his power in his muscles. So he basically has no strength to stand on his own or to sit. And as the disease progresses, it gets worse.
I think what's inspiring about the way that Boyd and Marion interact is that it's such an intense level of respect and understanding and love. I think Marion ultimately is incredibly strong and incredibly devoted, but there will come a time when Boyd's needs will become more challenging and maybe overwhelming, and at that time the CCAC will be there to provide whatever support she might need to be able to continue her role as a caregiver.
Lindsay has been great, tried to help us, reach out to us, and was very warm to us because we were new to this, and we were people that usually do everything for ourselves. So it was really hard to accept the help.
We could send the physiotherapist here to do a quick assessment at home, see how you're doing here in this environment.
When she's talking to you, she's looking right in your eyes, and Boyd and I felt like she was not just a worker.
I have to deal with it sooner or later.
Mm-hmm. But you don't have to deal with it by yourself.
No.
So it's not something that we expected the government to do. I didn't know anything about CCAC. I don't know those things.
Yeah, it's big changes, right? You've been through a lot. It's really different than where you were. And it's going to be different going forward. And I have some concerns about Mrs. Osborne in terms of her in the future. I think right now she's coping, but what we need to watch for with any family members is caregiver burnout, caregiver stress. It's tiring, and it's a 24-hour-a-day job.
I know.
Right now we're managing, but as we go forward, as his condition worsens, as he deteriorates, as she gets tired, maybe sick, we have to look at what supports we can provide to ensure that she's able to maintain her role as a caregiver, as a wife, as a friend, as a companion, and keep her healthy while we work to keep him healthy as well. Our healthcare system can be complicated to navigate, complicated to know who to talk to, who to ask questions to. So my role is really to provide them with insights, experience that I have, and help connect them in the system. This is Lindsay calling from the Toronto Central CCAC. How are you? Hello. How are you? Good. Thank you for meeting me. So yeah, I guess ultimately I would just like us to be able to take a look at the falls situation. When we're doing our care coordination, we come at it from a perspective of one client, one team, and we understand the importance of pulling in as many resources as possible to support someone, and the understanding that we can't do everything operating separately. We're kind of here today to take a look at like the falls issue. Susan lives in a group home. She's lived in a group home for about 15 years, and she's supported there with a couple other roommates.
Their medical status, if anything has changed, any new medications that have been introduced.
Her group home reached out to the CCAC because over the past few months, there's been a significant change. She's been falling a lot. She's been losing a lot of weight.
I'd say there's a complete fall at least every 2 weeks.
And they're just wondering what's happening with her and if they could get some help. So today we went for a visit with one of our dementia nurse specialists and a nurse practitioner and myself to just do some deeper assessment, find out what's going on, and see what we can do to help keep Susan at home versus going to long-term care.
When was the last time that she saw her doctor?
I took her about a month ago in the evening.
She is a typical client, complex needs, good support in the community, but just needs a little bit of help.
About a month ago.
A big part of my job is working with not just the client, but their families and their caregivers. So like what we saw today with Marion and Boyd, it is so important to involve the caregiver in decisions, in planning, in goal setting, because ultimately we come in and out of someone's life, but that caregiver is there with the person for their entire life. And we want to be there to support them, because as long as they're able to feel supported, they're able to support our client. And ultimately that's what's important. In the case with our client this afternoon, we were able to pull in a dementia specialist. We were able to pull in a nurse practitioner, their caregivers in the community, as well as come up with a plan on how to pull in the family doctor and other specialists in the community so that we're able to provide a cohesive care plan for a very complex situation in the community. I think sometimes our role extends beyond understanding just what the client's medical needs are. Sometimes we have to understand there's all kinds of other factors, socioeconomic factors, marginalization, histories of trauma. Sometimes clients don't have caregivers at all. So our role is really to pull in any support necessary to help the client achieve their goals and to keep people where they want to be.